What's going on, world? Welcome. Hey, what's up, everybody? Hey, happy Wednesday. Happy Wednesday to everybody. Hope everybody's having a really good midweek. We are about to do NCLEX questions. You guys already know the deal. We're doing NCLEX questions today. So, of course, you guys already know what I want. I want to know who you are, where you're from, where you're at in your nursing journey. We're going to be doing NCLEX question today. Hey, I need 1,000 likes and I need 100 people up in here. Hey, if you took your NCLEX this week and you have not told me, tell me. That way we can celebrate you. Hey, if you guys are just now joining, my name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go over there. You guys follow me on YouTube, on the gram, on all that other stuff, right? But then also, I've been a nurse for almost 4 years. It'll be 4 years next month. I worked ICU, OR, and PACU. What's up, love, Darlie? How are you? How are you? Hey, so you guys already know the deal. We're going to do some NCLEX questions today. Hey, first round, 10,000 likes. All right, but I need 1,000 likes for us to get started. You know, city girl, I see you out there. All right, hey, but I need 1,000 likes, all right? Make sure you guys share the live as well, all right? That pushes the algorithm. So I need 1,000 likes. I need 100 people up in here so y'all can get this, so we can get this thing going. But anyways, I want to know who you are, where you're from, where you're at in your nursing journey. If you're not a nurse, what are you doing here hanging out with us? What are you doing here hanging out with us today on this Wednesday? What are we thinking? What are we thinking? Well, what do we got going on? What y'all want to talk about before we get all these folks up in here? So what's up? Hey, so if you guys are just now joining, we are about to do NCLEX questions. I need 1,000 likes. I got 100 people up in here. So everybody need to be smashing that like button so you guys can get these questions. Hey, we're going to have a good time. All right. We're going to have a good time. All right. Make sure you guys participate. Participation is the key. All right. Answer the questions, help each other out in the chat. Also, remember that different people are in different stages of their education. All right. Different people are in different stages of their education. So you have to be aware of that. Some people haven't started nursing school, and then we get nurses that are 40 plus years, working in the field. So we got to understand that. All right. And as long as you guys understand that, have a good time in the chat, then you're not going to get banned, because you probably will get banned because I'm petty. Right. So would you recommend LPN school? I would ask you, what would your finances look like? That would be number one. Number two, if your finances aren't looking all that great, LPN is definitely a way to start for sure. But LPN school doesn't mean that it's not hard, because LPN school is hard for sure. I'm getting ready to study for my NCLEX RN. I just finished RN school, graduation soon. Shout out to you, lovely darling. Hey, we got 1,000 likes up in here. So let's go ahead and let's turn this thing around. Hey, here we go. You guys know I do this every Monday, Wednesday, Friday at 5:30, and let go. You're a pre-student. Shout out to you. Is it Grizzy? Shout out to you, Noemi or Naomi from St. Louis. Shout out to you. Almost done. Here we go. Question number one. The nurse is aware that the following terms describe or used to describe reduced cardiac output and perfusion impairment due to ineffective pumping of the heart is what? Is it anaphylactic shock, cardiogenic, distributive, or a myocardial infarction? What are we thinking? I'm an RT. In entry to practice MSN. Shout out to you. Kate, what's the deal? Hey, if you guys are not paramedics, or you guys ever want to be paramedics and go the PN or go the PA route, Kate is your girl, because she's the one who's doing that right now. So what do we think the answer is, y'all? What do we think the answer is? All right. Hey, by the way, if you guys are new here, welcome. Make sure you guys smash that like button. You guys share, you guys follow. We are on the road to 10,000 likes. 10,000 likes. Make it happen. Katie, what's up? How are you? Katie is a frequent flyer, so welcome back, Katie. All right, everybody's telling me B. All right. Also, make sure you guys share. I don't care how you feel. What's up, Bria? I don't care how you feel about those other people you're in school with. Don't be selfish. There's plenty of me to go around. Pause. You know what I'm saying, all right? So make sure you guys share it. Don't be selfish out here, all right? Here we go. But the answer indeed is B, because cardiogenic shock is shock that's related to ineffective pumping of the heart. Cardiac having to deal with the heart. Now, the biggest thing is it is involved with physiological adaptation, which is the third largest section on the NCLEX exam, all right? The third largest section on the NCLEX exam at 11 to 17%. Savage, congrats to you. You just graduated. Hey, congratulations on graduation. Shout out to everybody that graduated this past week, if I didn't get to tell you that, all right? But also understand what NCLEX, what the categories, what they mean, okay? LPNs, you guys have to know the same exact stuff that an RN has to know. All right, you have to know the same exact stuff that an RN has to know. Your scope of practice is what's different, okay? Here we go. Question number two. A client with hypertension Asked the nurse which factor could cause blood pressure to drop to normal levels. Is it kidney excretion to sodium only, kidney retention of sodium and water, kidney excretion of sodium and water, kidney retention of sodium and excretion of water? What are we thinking? Oh, wait, hold on. What happened? Somebody did something? Whoa, Kevin Pierre says, I passed my NCLEX PN. I watch your live sometime. Appreciate that. Hey, shout out to Kevin for passing his NCLEX PN. Right here, I'm going to pin you, sir, right there. Y'all show Kevin all the love right now while you guys are giving you guys his answers. Kevin, welcome to the greatest shit show on earth, known as being a nurse. Doesn't matter if you're an RN or an LPN, all right, because LPNs are nurses, all right? Don't get it twisted, all right? If there's a piece of advice that you could give to everybody out here, sir, what would it be? What would it be? All right, and once again, congratulations to you. Get it, Kevin. That's what I'm talking about. Hey, Kevin's a good name, man. I got Kevin too. So I take my NCLEX on Tuesday. Please pray for me. You got it. You got this whole thing. All right. But the answer is C. Kidneys excretion of sodium and water. The kidneys respond to a rise in blood pressure by excreting sodium and excess water. This response ultimately affects systolic blood pressure by regulating blood volume. That's also part of physiological adaptation, the third largest section on the NCLEX exam at 11 to 17%. All right. So make sure you got, by the time you guys start reading these questions, you should be able to recognize what category that they come from. Okay. And then it becomes no new news to you. All right. It becomes no new news. Whoa, hold on, Kevin. I just passed my NCLEX. I found out today. Thank you. Woo, that's what I'm talking about. I don't know what your name is, so I'm going to pin you. I'm just going to call you Hart. All right. Hey, there goes number 2 right there, y'all. Hart, whoever that individual is. All right. Hey, congratulate Kaylee. All right. Kaylee. Her name is not Hart. Her name is Kaylee. Kaylee. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice you could give to everybody out here, what would it be? Once again, Kaylee, congratulations to you. Welcome to the shit show to everybody that becomes a nurse, all right? I mean that with all love, all right? So congratulations to you. Here we go. Question number 3. Nurse Rose is aware that the statement that best explains why furosemide is administered to treat hypertension is what? What would it be? How long does it take to get your ATT? It could take anywhere from 2 to 4 weeks for you to get your ATT, all right? It dilates peripheral blood vessels. It decreases sympathetic cardio acceleration. It inhibits the angiotensin converting enzymes, or it inhibits the reabsorption of sodium and water in the loop of Henle. What do we think this answer is? All right, we got some B's, we got some C's, we got some A's. Shout out to everybody that's out here rocking. We're doing NCLEX questions. Make sure you guys like, share, follow. Hey, share it. Share the live, all right? Stop being greedy out here. All right. It's literally D. Claire. Okay. She says it's literally D. Literally. All right, well, let's see what the answer is. All right, here we go. And the answer is literally, it's D. Literally. All right. It inhibits the reabsorption of sodium and water in the loop of Henle. Okay, so furosemide is a loop diuretic that inhibits sodium and water reabsorption in the loop of Henle, thereby causing a decrease in blood pressure. It says, good luck, everyone studying for NCLEX. You got this. Alexis, let them know. Let them know what's up, all right? This is actually part of pharmacological and parenteral therapies, all right? Pharmacology, second largest section on the NCLEX. LPNs, you learn the same content that RNs learn, all right? There's things that you can't do and you can't accept. You have to understand that. Doesn't matter what your state says. This is a national exam. Essen says, I got a job offer before I graduate in December, future labor delivery nurse. Love it. I love it. Love that for you. Congratulations. Quick question, Mr. Kevin. What do you think I should do while I wait for my ATT? You need to keep studying content and you need to be doing questions. That's what you need to be doing until you get that. Just because you don't have it doesn't mean that you shouldn't be putting in the work before you get it. All right. Here we go. Question number 4. Nurse Nikki knows that the laboratory results support the diagnosis of lupus is what? Is it elevated serum complement level? Is it thrombocytosis with elevated sedimentation rate? Is it pancytopenia with elevated anti-nuclear antibody titer? Or is it leukocytosis with an elevated BUN and creatinine level? What do we think it is? Shout out to all 207 of y'all. Appreciate y'all for being here. If you are new here, I want to know who you are, where you're from, and where you are at in your nursing journey. Let's try to, stimulate a little bit of chat down here in this little chat room, as well as give me your answers to this question. All right. One of my biggest things when you guys are reading your question is to read your question fully. All right. I say RTFQ. Who can tell me what RTFQ means? Who can tell me what that means? Mary, I'm currently an LPN student. Shout out to you from Mississippi. Okay. or Missouri. No, it's Mississippi. I remember now. From California, an LVN student. Shout out to you, Scarlett. All right, y'all. What's the answer? All right. Is it Zariah, LPN in Florida? Shout out to you in the bridge program. I'm from West Texas. Shout out to all my Texans out here. Read the F in question. You already know what the deal is. Hey, tell me what the F stands for. And RN for the Philippines. Shout out to all my Filipina nurses out there. I love y'all. Y'all are amazing, amazing individuals. I learned so much from my Filipino nurses. I love y'all. All right, here we go. The answer is C. It's pancytopenia. Laboratory findings for clients with lupus usually show pancytopenia with an elevated ANA titer and decreased serum complement levels. That is part of reduction of risk potential. All right, reduction of risk potential, which is 9 to 15% on the NCLEX exam, making it the fourth largest section. There's 4 sections that are some heavy hitters: pharm, management of care or coordinated care, physiological adaptation, and reduction of risk potential. They make up almost 60%. All right, more than half of the exam. All right, so make sure you guys understand that. Make sure you guys understand that. Okay, here we go. Question number 5. Arnold, a 19-year-old client with a mild concussion, is discharged from the emergency department. Before discharge, he complains of a headache. When offered acetaminophen, his mother tells the nurse that the headache is severe and she would like her son to have something stronger. Which of the following responses by the nurse is appropriate? All right. Is it your son has a mild concussion? Acetaminophen is strong enough. Aspirin is avoided because of the dangers of Ray's syndrome in children or young adults. Is it narcotics are avoided after a head injury because they may hide a worsening condition? Or is it stronger medications may lead to vomiting, which increase intracranial pressure? What do we think that is? Hey, if you guys are just now joining, welcome. My name is Kevin. I'm a registered nurse, BSN, if you really, really care about that. I've worked ICU, specifically in a burn ICU and a medical ICU, and I worked PACU in an operating room. And I was in the military for 16 years. I actually just got out this past January. So, coming here, give y'all the talents and all the love of learning how to pass this NCLEX. So shout out to each and every one of y'all for being here. All right. But let's see what our answer is. And the answer is C. Narcotics are avoided after a head injury because they may hide a worsening condition. All right. Princess SRB, not the SRB. Appreciate your support. Narcotics may mask changes in the level of consciousness that indicate an increased ICP. All right. Appreciate all the love from y'all. Appreciate all the love. But that's part of health promotion and maintenance, right? Which is 6 to 12% on the NCLEX. It's still very much important, but it's a lower section on the NCLEX. All right. But just remember that they can actually bring all the categories together. All right. They can bring all the categories together, but there's going to be a main one that they're going to talk about. Hey, but if you guys are new here, hey, check this out. If you guys are studying for NCLEX and you guys need help and tips, I have an ebook that I made that I used to sell that I give for free. All right. It's test taking tips to conquer the NCLEX. Why? Number one, in order to conquer the NCLEX, you have to get out of your own way. That's number one. Number two, it's free. You get there's 42 pages in there. Look, check this out. You see that fanny pack? You don't get that. You don't get that. Somebody said, how much is it? It's free, Rosie. I just said that. Free, Free, free 99. All right, you guys can go over there. You can check it out. The link is in my bio. All right, or you guys can go to the website right now, thebootnurse.com/test, and you can get it for free. All right, it's 42 pages of buttery, delicious goodness with that melanated man with that fanny pack just provided. All right, so stop playing games. All right, and go over there and go get that for yourself. All right, here we go. Question number 6. All right, question number 6. When elevating an arterial blood gas from a male client with a subdural hematoma, the nurse notes that a PaCO2 is 30 millimeters of mercury. All right, 30 millimeters of mercury. Which of the following responses best describes the results? Is it appropriate to have a lower CO2 because it reduces intracranial pressure? Is it emergent because the client is poorly oxygenated? Is it normal? Or is it sufficient? All right, because the client has alveolar hypoventilation. What do we think it is? Hey, shout out to all 250 of y'all. Hey, make sure you guys like, share, and follow. We're on the road to 10,000 likes. Hey, if we get to question number 10, and if I don't have 10,000 likes, my throat hurts. Pause. You know what I mean? All right. I'm just letting y'all know. Y'all want these questions? Give me these likes. Give me these shares. Stop being selfish out here. All right. Geraldine, I see you. All right. Hey, remember, read the question. RTFQ. I read it wrong first. Look at that. Look at that. All right. That's why I say RTFQ, ladies and gentlemen. That's exactly why I say it. Read the effing question. Because if you don't read it all the way, there could be one word that can change the entire answer. All right. So what are we thinking that it is? If you're new here, I want to know who you are and where you're from and where you're at in your nursing journey. And if you're not a nurse, what are you doing here rocking with us today here on this Wednesday? All right. Here we go. And the answer is A, appropriate. It is appropriate. So a normal PA CO2 value is 35 to 45 millimeters of mercury. CO2 has vasodilation properties. Therefore, a lower PA CO2 through hyperventilation will lower ICP caused by dilated cerebral vessels. This is reduction of risk potential. What's up? Is it Delia or Delia? Shout out to you. I live in San Antonio. Shout out to all my folks that live in San Antonio. I love y'all. You know what I'm saying? Reduction of risk potential, 9 to 15% on the NCLEX exam, making it the 4th largest section. I start in PACU in June. I just graduated. Shout out to you. You're going to like PACU. We'll be taking the NCLEX in a month. Love it. Hey, make sure you keep preparing. Hey, do not stop before the finish line. Ladies and gentlemen, do not stop. Just because you're waiting on your authorization to test, guess what? You still got work to put in. All right. Just because you got your authorization to test, guess what? You still got work to put in. All right. So put in the work. All right. Is it Dolly? Thank you for the hand heart. I appreciate you. You still got work. It says I just passed my HESI exam and started nursing school soon. I'm from NY. Is it Toki or Taki? Shout out to Takis. I like Takis, but shout out to you. Deciding whether Archer or UWorld for prep. So it all really just depends on you. Both of them work really well, and I suggest either one of them. Archer's a little bit less on the pocket. But, you know, both of them give really good questions, in my opinion. All right, here we go. Question number 7. When prioritizing care, which of the following clients should the nurse Oliver assess first? So who could tell me what type of question that this is? Right off the bat, what type of question is this? All right. So who should this individual see first? Who's going to die if I don't see them first? All right. Is it a 17-year-old, 24 hours? It's a priority, right? Prioritization. All right. Okay. So do I want to see a 17-year-old who was 24 hours post-appendectomy? Probably not, right? Is it a 33-year-old who recently, with a recent diagnosis of Guillain-Barré or Barr syndrome? Is it a 50-year-old who was 3 days post-MI? Or is it a 50-year-old with diverticulitis? What are we thinking? All right. Is that doctor in here saying the answer is E? Sir, first of all, you know that the answer choice E is not here. Sierra from Memphis. Oh, you from a war zone. All right, Sierra, be careful out there. Taking the NCLEX in 2 weeks. You're so nervous. It's okay for you guys to be nervous. It's a part of the process. All right. It is all very much part of the process. The biggest thing that you need to do is that we need to figure out a way to conquer that. All right. And the best way for you to conquer that, no lie, is for you to recreate the testing center. All right. So, but the answer is B. The answer is B. It is indeed a 33-year-old client who has GB syndrome. All right. It's characterized by ascending paralysis and potential respiratory failure. The order of client assessment should be should follow client priorities with disorders of airway, breathing, and circulation. Also, make sure when you guys are looking at this, level of consciousness is also a part of it. All right. Your level of consciousness can tell you a lot about a patient's airway, breathing, and circulation, right? Agitation is a part of that. Keyword is recent. Yes, the keyword is recent. That's part of management of care, which is 15 to 21% for RNs and 18 to 23% for LPNs. LPNs, it's called coordinated care. Same concept. You need to know what you can and can't do, what you can and cannot accept. Okay. That is what is a part of management of care. All right. My professor taught me that. Love it. Love it. All right, here we go. Question number 8. JP has been diagnosed with gout and wants to know why colchicine is used in the treatment of gout. Which of the following actions of colchicine explains why it's effective for gout? Does it replace estrogen, decrease infection, inflammation, or bone demineralization? What does it do? All right. What does it do? Shout out to all 159 of y'all. We're doing NCLEX questions. I got them off of nurseslabs.com. These are free sets of questions. All right. These are free sets of questions. You guys can go over there and check those out for yourself. Can you tell me what is physiological integrity and how to study those areas? So for physiological integrity or adaptation, that has to do specifically with pathophysiology, the disease process and how it affects the body. All right. So we talk about diabetes. All right. So we think about diabetes type 1, type 2. We think about DKA. We think about HHNS, right? Those are diabetes has all these other disease processes that are a part of it, right? But we need to know how it affects the body. And once we understand how it affects the body, we need to know how do we treat it based on the effects that it is showing us. All right. And it also includes chronic issues such as like COPD and acute issues such as a myocardial infarction. Right. What do we do when we see somebody who has a myocardial infarction? That's what physiological adaptation is. All right. So the answer indeed is C, is decreased inflammation. All right. You have to know the disease. You have to know the disease process. You have to know the disease process. All right. Or at least make yourself familiar about the disease process. All right. The action of colchicine is to decrease inflammation by reducing the migration of leukocytes to synovial fluid. That is physiological adaptation. Shout out to you, Agnes. I see you. Shout out to you. Physiological adaptation, which is 11 to 17% on the NCLEX exam. Look, they were just talking about gout. Is that not a disease? Right. And they want to know why is this medication given? Right. To decrease the inflammation. This could be part of physiological adaptation as well as pharmacological adaptation. Right. So think about that. All right. Shout out to y'all for getting that answer correct. If you got it wrong, circle back and get the content. OK, here we go. Question number 9. Norma asks for information about osteoarthritis. Which of the following statements about osteoarthritis is correct? It is rarely debilitating. It is a rare form of arthritis. It is a common form of arthritis, or it only affects people over the age of 60. Is it Kimana? Kimana, ATL. Shout out to you, Kimana. Or Kimana. No, it's Kimana. I got you. ATL ADN program start cohort in June. Shout out to you. Shout out to you, Miss Lady. Hey, if you guys are just now joining, welcome. Hey, I want to know who you are, where you're from, and where you're at in your nursing journey. It's either, Rosie's telling me it's either B or C. Ma'am, give me one answer. Give me one. Go with your gut answer. 9 times out of 10, your gut answer is the correct one. If I say only or always, it's usually not right choice. Correct. I take my boards tomorrow. Hannah, we talked about this earlier. Hannah, you're going to do fantastic. All right. It's common. All right. Well, let's see what the answer is. Indeed. 3 months from graduation. Shout out to you, Nicole. But the answer is C. The answer is C. Shout out to Phoenix. Is it Kaylin? I see you. All right. Osteoarthritis is the most common form of arthritis and can be extremely debilitating. It can afflict it can afflict people of any age, although mostly are elderly. Once again, this is physiological adaptation because we're talking about osteoarthritis, which is a disease, and we want to know how that process works, right? So pathophysiology. Physiological adaptation, 11 to 17% on the NCLEX exam. Allison, I see you. Rosie is from, where are you from? From Memphis? From Memphis. Man, y'all, I got some people from war zones up in here. You know what I'm saying? Y'all be safe out there. No, but shout out to y'all. It says, do you recommend any other free question sites? The only one that I know that has, there's a bunch of other ones that you can get like free, like little quizzes through. Like I know Simple Nursing, you can get free quizzes through and stuff like that. I think nursing.com is also another one. But when it comes for NCLEX, I'll always tell you when it comes to questions, I like Kaplan. I like UWorld. I like Kaplan. I tolerate UWorld. I like Archer. All right, here we go. Question number 10. Ruby is receiving thyroid replacement therapy, develops the flu, and forgets to take her thyroid replacement medication. The nurse understands that skipping this medication will put the patient at risk for developing which of the following life-threatening conditions? Is it X ophthalmos? Katie, you're welcome. A thyroid storm, myxedema coma, or tibial myxedema? What are we thinking? Now let's think about this. What person, this is why I want you to read the question again. RTFQ, all right, read the question again. We have two different types we have the two main thyroid issues. We have hyper and we have hypothyroidism, right? Who is going to be using a thyroid replacement medication? All right, let's think about that. Which person would use a thyroid medication? Okay, now, based off of that, if this person did not take this medication, right? If this person didn't take this medication, what would the end result be? Thyroid storm is the most serious. It depends on which thyroid issue you have. So does this thyroid storm, does that go with someone who doesn't produce enough, or is it the overproduction? So let's think about that. Both are very important, but they go specifically with one another. One goes specifically with one. All right. So let's look at it. So the answer is C, because myxedema coma, which is severe hypothyroidism, is a life-threatening condition that may develop in thyroid replacement medication is not taken. Is not taken because it gives you the hormone that you are not producing enough of. All right. Pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. All right. Listen, y'all, you have got to get a grip on pharmacology. Trust me, as someone who didn't do well on pharm, when it came to the NCLEX and I finally figured it out, trust me, you need and have to understand that because pharmacology does not go away. It does not go away. All right. So make sure you guys get an understanding of that. Read it, go back, circle back, get your answers, right? Read your rationale. Pharm is my weak point. Okay. Then that's where you want to start. Ladies and gentlemen, once again, it says this is why you RTFQ because I just heard life threatening and I was like thyroid storm. Just because I say life threatening doesn't mean that it's always thyroid storm. So there you go. Sugar. Test taking tips to help you conquer the NCLEX. Hey, it's free. Free 99. Free 99. Make sure you guys go over there and check it out. It's 42 pages, y'all. 42 pages. All right. Go over there and get that for yourself. All right. And don't say I never gave y'all nothing. All right. Because y'all out here wilding. Making it seem like, honey, you know what's up. So shout out to every single one of y'all. Hey, here we go. Question number 11. Hey, we're on the road to 20,000 likes. Get carpal tunnel for me. Let's make it happen. Nurse Sugar. Look at that. Ain't that funny? Nurse Sugar, All right, is assessing a client with Cushing syndrome. Which observation should the nurse report to the physician immediately? Immediately. What is love? Appreciate the let them cook. I appreciate you. Is it pitting edema of the legs? Is it irregular apical pulse? Is it dry mucous membranes? Or is it frequent urination? All right, so we're talking about ABC. So everybody's telling me B. All right, got B, we got B. Okay, what else do we think? Hey, if you guys are just now joining, welcome. We are doing NCLEX questions. Hey, if you guys are still here, I need for you guys liking, sharing, following. All right, liking, sharing, following. That's the trifecta that gets out to the For You page. All right, a little bit about me. I've been a nurse for almost 4 years. I was in the Navy for 16 years. Hey, and I failed my NCLEX 3 times. Hey, y'all, I failed my NCLEX not once, not twice, but 3 times. You know what I'm saying? So let me tell you something right now. Don't nobody care. Nobody cares how you feel about anything, all right? You have to get over it. You have to get over yourself. You have to get out of your own way if you want a license. You are the reason why you don't have a license. It's not the school. It's not the teachers. It's you. And I'm telling you that as somebody who failed 3 times and passed on the 4th. You are your problem and you need to get out of your own way. You know what I'm saying? Hey, and if you appreciate that, I appreciate you being here. This is what this is about, all right? Getting you guys familiar and getting you guys into a routine. All right, that's what it's all about. But of course, the answer is B. All right, the answer is B. The Lord will save us. Let me say, why are you failing? It's a bunch of things. My biggest thing is that my time management, my accountability. I didn't know how to study, what to study until I figured it out. All right, so here we go. The answer is B, because Cushing syndrome causes aldosterone overproduction, which increases urinary potassium loss. The disorder may lead to hypokalemia. Therefore, the nurse should immediately report signs and symptoms of hypokalemia, such as an irregular apical pulse to the physician. That is physiological adaptation. Which is 11 to 17% on the NCLEX exam. Time management is a big deal. All right, because I'm telling you right now, you could say that you're doing all the studying, but how effective is your time management? How effective is your studying? Are you studying the right thing? Are you studying long enough? Are you over studying? You know what I'm saying? Like, these are the things that you have to essentially I had to figure out. Right? Here we go. Question number 12. Cyril, with severe head trauma sustained in a car accident, is admitted to the intensive care unit. 36 hours later, the client's urine output suddenly rises above 200 mLs an hour, leading the nurse to suspect diabetes insipidus. Which findings support the nurse's suspicion of diabetes insipidus? What do we think it is? What do we think it is? How do you know if you're overstudying? If you can't retain what you learned. So if you're studying listen, and that all depends on you as a person. That all depends on you as a person. All right. Some people can study 4 hours and they'll be good. Some people need 6, some people need 8, but it's about the consistency as well. Like, I am not a big proponent of somebody telling me, yeah, I went to go get my oil change and I did it for, 20 minutes. So I did 5 or 10 questions. No, I don't like that because it's not consistent. You don't do that all the time. You don't do it every day. You need to have some type of consistency that is potentially uninterrupted. Just like when you go and take your exam, you're going to sit for 5 hours. You want to do that uninterrupted, right? And you can take breaks. You want to take breaks, right? You want to take breaks while you are studying for sure. And the answer is D. Right? Below normal urine osmolality level, above normal serum osmolality levels. Right? So in diabetes insipidus, excessive polyuria causes dilute urine, resulting in a below normal urine osmolality level. At the same time, polyuria depletes the body of water, causing dehydration that leads to an above normal serum osmolality level. That's physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX, at 11 to 17%. But yes, you do want to take breaks. Oh, you read the question wrong. So Kayla, you mean to tell me you didn't RTFQ? Shame, shame, shame. Shame, shame, shame. We got to read the question. All right. Did you start working immediately after school before studying for the NCLEX? Here's my thing. If you're going to take the NCLEX, you need to take it as fast as possible. You need to take it ASAP, because the longer that you wait, you'll start to forget all that information. So you need to take it ASAP. So you can work like under a temporary license, but you need to take that. You need to take that exam. All right. Jamari is diagnosed with hyperosmolar hyperglycemic non-ketotic syndrome, is stabilized and prepared for discharge. When preparing the client for a discharge and home management, which of the following statements indicate that the client understands her condition and how to control it? All right. I'm taking my NCLEX on May 30th. Is it NISA or NISA? You about to get me in trouble. TikTok is not going to nope, that's close enough. Ban. We don't want that, right? So, all right. Shout out to everybody that's here rocking. We're doing, it's NISA. Oh, okay. All right. You about to get me in trouble. My goodness. All right. Hey, like I said, if you guys are just now joining, I appreciate you. Got me to 15,000 likes. Hey, we need 20,000 likes by the time I get to question 20, or I guess y'all are just getting 20 questions today. I'm cool with that too. So I want to know who you are, where you're from, where you're at in your nursing journey. What are we thinking? All right. But time management is very much an important thing when you are studying for your NCLEX. Light work. I see you out there. All right. Shout out to South Africa. I see you. Is it MBS? All right. Let's see what the answer is. In 3, 2. All right. The answer is A. I can avoid getting sick by not becoming dehydrated and by paying attention to my need to urinate, drink, or eat more than usual. All right. So an adequate fluid intake during hyperglycemic episodes often leads to HHNS. By recognizing the signs of hyperglycemia, which is polyuria, polydipsia, and polyphagia, and increasing fluid intake, the client may prevent HHNS. This is part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. All right, 6 to 12%. I want to say this one's like number 6 out of the 8. All right, number 6 out of the 8. All right, so shout out to all 90 of y'all for answering this question. Hey, remember, the more participation, the better. The more participation, the better. All right, here we go. Question number 14. A 66-year-old has been complaining of sleeping more, increased urination, anorexia, weakness, irritability, depression, and bone pain that interferes with her going outdoors. Based on this assessment finding, right, the nurse would suspect which of the following disorders. Is it diabetes mellitus, diabetes insipidus, hypoparathyroidism, or hyperparathyroidism? What are we thinking? Hey, if you guys are new here, welcome. My name is Kevin. I'm a registered nurse. I've been a registered nurse for almost 4 years. BSN, if you really care. I worked ICU, OR, and PACU. I was in the Navy for 16 years. And I've been actually coaching people for the NCLEX for the last 4 years. And I've been learning about the NCLEX the last 6 years. So I love doing this. I love coaching. I love coming over here to teach y'all. You know what I'm saying? Because, hey, who's going to teach us but us? Naz, you got to give me one. Give me one, Naz. Give me one. All right. What are we thinking, y'all? What are we thinking? All right. All right. Here we go. Let's see. See right there? Let us see what the answer is. And the answer is D. The answer is D. You tried, Naz. It's all good. Hyperparathyroidism is most common in older women and is characterized by bone pain and weakness from excessive parathyroid hormone. Clients also exhibit hypercalciuria, causing polyuria. All right. Physiological adaptation. Okay. 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. All right. I should have known that. I should have known from last time. Yeah. It's all good. Remember, you can practice as many times as you want prior to taking this exam. I'd rather you get them wrong on practice exams and start to get them wrong less. Remember, on NCLEX, you're not meant to know everything, despite what everybody tells you. It's a test of basic competency. You need above a 50. I don't know what other exam you'll ever take in life that you need above a 50, and they'll give you a whole license. All right. Question 15. Nurse Lord is teaching a client recovering from Addisonian crisis about the need for the cortisone acetate and hydrocortisone at home. Which statement by the client indicates an understanding of the instruction? Sounds like it's best to study diseases and know farm patho and signs and symptoms. Absolutely. But then again, is that the area for yourself? Is that the area for yourself? Right? That's not a bad place to start. But there's a lot of people that are really comfortable with farm. So I would tell them, hey, if farm's not your spot that you're not doing terrible on, let's go look at a different spot. It could be maternal newborn. It could be peds. It could be critical care. Understanding your signs and symptoms, right, is understanding your cues. For the average person, how many days or weeks should you study and how much? And in reality, that really just depends on you and where you're coming from. If you're coming straight out of school, you should be studying NCLEX throughout all of nursing school, right? But you should really be doing it heavy your last 3 months of school. You should really be like diving into questions and really reiterating your content and everything while you're in nursing school 3 months before you graduate. All right. Now, if you're somebody who's failed your NCLEX or you haven't taken your NCLEX right out of school or it's been some years, you need some heavy studying, 30 to 45 days, but no longer than 90 days. Because if you're studying longer than 90 days, what are you doing with your time? And I'll be that person to call you out. Be like, what are you doing? All right. Here we go. Hydrocortisone, a glucocorticoid, should be administered according to a schedule that closely affects the body's own secretion of this hormone. Therefore, 2/3 of the dose of hydrocortisone should be taken in the morning and 1/3 in the late afternoon. This dose schedule reduces adverse effects, health promotions, and maintenance. 6 to 12% on the NCLEX exam. All right, 6 to 12% on the NCLEX exam. Listen, ladies and gentlemen, like I said, you don't need to know everything. You need to know what everybody else knows. Apply what you know versus trying to apply what you don't know. That's how you do process of elimination. Select all that applies, same concept. Apply what you know versus trying to apply what you don't know. Once again, the website is thebootnurse.com/test. You get you some test taking tips to help you conquer the NCLEX. It's 42 pages. 42 pages, a 4 and a 2. All right. It used to be one of my ebooks and now you guys get it. All right. So go over there and check that out. All right. We're on the road to 20,000 likes. 20,000 likes plus a free ebook. Come on, y'all. What are we doing? What are we doing right now? Make sure y'all go over there and get that. All right. Here we go. Question 16. Which of the following laboratory test results would suggest to the nurse, Lynn, that a client with a corticotropin secreting pituitary and angioma, oh my goodness, which one of these results would suggest that? How much longer am I going to be on? I don't know. That just depends on how many likes I get. So yeah, there's that. Hey, but what's up, everybody? For everybody that is new here, all right, and welcome. We're doing NCLEX questions. Hey, I need for you guys to smash that like button. All right, I need for y'all to share. I need at least like 100 shares. I got to get to the For You page. for you and me. That's what I need. All right. But if you're new here, welcome. But I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not, if you're not a nurse, what are you doing here hanging out with us? What are you doing here hanging out with us? All right. Well, let us see. Let us see what the answers are. Yeah, let them know. Let them know. Share it out. I don't care if you got to share it to Mima. I know Mima got a flip phone and probably ain't got TikTok or whatever. You know what I'm saying? Share it to Mima. She might like me. You know what I'm saying? But the answer is C, high corticotropin and high cortisol levels, right? Because high corticotropin secreting pituitary tumor would cause high corticotropin and high cortisol levels. That's reduction of risk potential. The reduction of risk potential, which is 9 to 15% on the NCLEX exam. All right, 9 to 15% on the NCLEX exam. Remember, this is from nurseslabs.com. They're free sets of questions. You guys can go over there and check them out for yourself. Hey, but when it comes to NCLEX questions, as we're getting to the routine of you guys studying, I like Kaplan, I like UWorld. I like Kaplan, I like Archer, I tolerate UWorld. All right. So just saying. That's where I would recommend you guys get your question banks from. All right. That all just depends on you. And they all work. They all work. All right. Here we go. Question 17. A male client is scheduled for a transfenodal hyposphenectomy to remove a pituitary tumor. Keyword is pituitary. Preoperatively, the nurse should assess for potential complications by doing which of the following? All right. Test for ketones in the urine, testing urine specific gravity, checking temperature every 4 hours, or performing capillary glucose testing every 4 hours. What do we think the answer is? D. B, because of DI. Okay. What else? Everybody's telling me D. All right. Maritza is here, y'all. I don't know if y'all know Maritza. They probably don't. That's okay. Maritza, it only matters that I know you, so that's fine. She's saying D. Rose is saying D. Light work, telling me C. Slay, I see you, telling me D. It says this chick is bad to the bone. It's telling me D. Okay. Hey, this is kind of off topic, but anybody see Meg Thee Stallion's, her new music video? Wild. All right, here we go. Here's our answer. So our answer is D, right? Performing capillary glucose testing every 4 hours, right? Is D. I remember. Right. I need to circle back to endocrine. There it is. Endocrine is huge. Diabetes, all aspects of it is huge. All right. The nurse should perform capillary glucose testing every 4 hours because the excess cortisol may cause insulin resistance, placing the client at risk for hyperglycemia. All right. That is reduction of risk potential, which is 9 to 15% on the NCLEX, making it the fourth largest section on the NCLEX exam. LPNs, you learn the same content that RNs learn. All right. You just need to know what you can and can't do and what you can and cannot accept. It says same. This is stressing me out. Listen, it's not meant to stress you out. It's meant to give you direction. That's it. It's meant to give you direction. That's it. All right. So if you didn't know that endocrine was where you need to start, guess what? Now you know endocrine is your starting spot, right? It's not meant to cause you stress, But then again, stress is part of the process. Am I dumb? Why does the pituitary affect? Oh my God, I was about to say that wrong. Cortisone. No, you're not dumb. It's all about, like I said, it's all about understanding what does what within the body, right? So think about it. We are talking about doing a hypophenectomy, a transfenodal hypophyseectomy. Oh my God, I cannot say that right? And we're talking about what happens with the pituitary gland. Think about what happens with the pituitary gland. Oh, I moved the camera. Oopsie. Those are my files. All right. So that's all about understanding that disease process and understanding what happens when you have less secretions within your pituitary gland and when you have more. All right. So here we go. Question 18. Capillary glucose monitoring is being performed every 4 hours for a client diagnosed with DKA or diabetic ketoacidosis. All right. Insulin is administered using a scale of regular insulin according to glucose results. Right. At 2 p.m., the client has a capillary glucose level of 250 milligrams per deciliter, for which he receives 8 units of regular insulin. All right. the nurse should expect the dosage what? So we're talking about the onset, the peak, and the duration of insulin, right? So will the onset be at 2 and its peak at 3? Onset at 2:15 and a peak at 3? Onset at 2:30 with a peak at 4? Or onset at 4 with a peak at 6? What are we thinking? What are we thinking? Hey, if you're new here, smash that like button. Make sure you guys share. Make sure you guys follow. Make sure you guys share. You guys follow. All right, y'all. What are we thinking? We got C. We got C. Think about it. We talk about regular insulin. We talk about Lispro, right? We talk about our intermediate, our NPH, right? We talk about glargine, our long-acting insulins, right? We need to know what our onsets and our peaks and our durations. This is something that you get in your content. If you're not familiar with endocrine, this is where I recommend that you go and you circle back, all right? But here's our answer, and our answer is C, all right? Our answer is C. The onset will be at 2:30 with the peak being at 4. Regular insulin, which is a short-acting insulin, has an onset of 15 to 30 minutes and a peak of 2 to 4 hours. All right. Because the nurse gave the insulin at 2 p.m., the expected onset would be from 2:15 to 2:30 and a peak from 4 p.m. to 6 p.m. All right. That's part of pharmacological and parenteral therapies. Why? Because we're talking about we're administering insulin. You see how they could actually rope these multiple categories into one another. All right, they can rope pharmacological and parenteral therapies. I can rope into physiological adaptation because we're talking about diabetes, right? We're talking about DKA. All right. So, but this question is specifically talking about the onset, peak, and duration of a medication, which falls under pharmacological and parenteral therapies. Now, 13 to 19% on the NCLEX, making it the second largest section. All right. LPNs, you learn the same content that RNs learn. Okay. You learn the same content that RNs learn. Don't forget that. Here we go. Question 19. The physician orders laboratory test to confirm hyperthyroidism in a female client with classic signs and symptoms of this disorder. Which test results would confirm the diagnosis? What do we think it is? What do we think it is? Shout out to all 85 of y'all. Hey, make sure you guys keep smashing that like button. Y'all got me to 20,000 likes like on the dot. So I appreciate y'all. Hey, give me to 30 right now and make it happen. I love y'all. I appreciate y'all. Make sure you guys keep sharing. And if you're new here, like I said, I want to know who you are, where you're from, where you're at in your nursing journey, your nursing process. You know what I'm saying? And make sure you guys drop those down in the comments as we foster a good relationship down here in the comments. Also, remember that everybody is different. Everybody is different in their journey. Some people are just now starting nursing. Some people have been nurses for 40 years. All right. So we have to meet everybody where they are. You have to meet people where they are. All right. Whole point of doing this live is to get you into a routine. All right. Get you into a routine. But here's our answer. Here's our answer in 3, 2. And the answer is A, no increase in the thyroid stimulating hormone level after 30 minutes during the TSH stimulation test. All right, because a rise after 30 minutes will confirm hyperthyroidism. All right, that's a reduction of risk potential. The reduction of risk potential is 9 to 15% on the NCLEX exam, making it the 4th largest section on that exam. All right, LPNs, same thing. Content, same thing. Content. All right. So shout out to y'all for getting it right. And if you didn't get it right, circle back. Circle back. All right. Here we go. Question number 20. Rico with diabetes mellitus must learn how to self-administer insulin. The physician has prescribed 10 units of regular insulin and 35 units of NPH to be taken before breakfast. When teaching the client how to select and rotate injection or insulin injection sites, the nurse should provide which instruction? So yes, we are talking about medical administration. So how do we properly administer this medication? All right, what are we thinking? Here we go. What do we think? Everybody screaming B at me. Cool. All right. Well, let's see what the answer is. Let us see what the answer is. And the answer indeed is B. Want to rotate injection sites within the same anatomical region, not among different regions. The nurse should instruct the client to rotate those injection sites within the same anatomical region. Rotating sites among different regions may cause excessive day-to-day variations in the blood glucose level. Also, insulin absorption differs from one region to the next. That's actually part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. All right. It's all about the absorption. You want to keep it around. You want to keep it within the same region. All right. I thought stomach and arm adipose tissue. So if you're going to do it in the arm, you're going to keep doing it in the arm. So like if we're going to do an adipose tissue, like we'll say in the upper arm, switch it to the other arm. All right. So we're talking about when you talk about rotating, right? Rotate between the different quadrants, right? If we're going to be doing it on the abdomen. So I figured this with health promotion. Look, Bria, after a while, you're going to know where where the questions fall under. You're going to know what category they fall under after you see them for so long, right? Once again, ladies and gentlemen, hey, if you haven't gotten that already, go over there and get that. Some test taking tips to help you conquer the NCLEX. Hey, send the website to somebody else who might need it. You know what I'm saying? Everybody, hey, listen, there's nothing wrong with you getting a little bit of help. You know what I'm saying? Everybody's just like, oh, I feel like I can do it by myself. I don't need no help. Let me tell you something right now. There's nothing better than having somebody who's been in the position that you're currently in to help you cancel out all the noise and get you from point A to point B. Trust and believe me when I tell you that. A lot of people ask me, hey, how did you pass your NCLEX on the 4th time? Biggest thing is that I got a mentor. That's one of the biggest things that I got, is that I got a mentor, someone who had been in the position of where I wanted to be and where I continue where I want to be. And they got all the nonsense out of my face. All right. I sent your website to a couple people preparing for the NCLEX. Bria, I love it. I appreciate you sending them to all of that stuff. All right. I appreciate that. Here we go. Question 21. Nurse Sarah expects to note an elevated serum glucose level in a client with HHNS. Which other laboratory findings should the nurse anticipate? All right. Is it an elevated serum acetone level, serum ketone bodies, serum alkalosis, or below normal serum potassium level? What are we thinking? Shout out to all 80 of y'all. Man, I just not thought about this. If I was doing this live, like in person, there would be 80 of y'all in a room staring at me. That's weird, huh? That's weird. So think about it. There was 1,600 people in there just looking at you. Be like at a Kevin Hart stand-up. What's up? What do we think it is? It says potassium allows insulin to enter the cells. Okay. Look at that, Katie. You smart, Miss Lady. Look at that. You're going to do all right on that exam. Hannah's telling me C. Hannah, why are you still here? Didn't we have this conversation? We be looking at your hairline. Oh my God. I just got roasted. I don't like you no more. We're not friends no more. Here we go. Here's our answer. 3, 2. And the answer is D, below normal serum potassium levels. You're kidding? Nah. You finna get banned. All right. But a client with HHNS has an overall body deficit of potassium resulting from diuresis, right, which occurs secondary to hyperosmolar hyperglycemic state caused by the relative insulin deficiency, right? Insulin deficiency, 9 to 15% on the NCLEX, which is reduction of risk potential. That is the 4th largest section on the NCLEX exam, all right? So make sure we understand this. Hey, guess where this falls under? Falls back under endocrine, right? Because we're talking about HHNK, or HHNK, which is something that happens with type 2 diabetics, right? So make sure that we understand that. All right. I'm telling you, diabetes and endocrinology, that is stuff that NCLEX loves to test over. Why? Is because it is something that is normally seen out in the field. Those are the things that you're normally going to be tested on, is what is normally seen out on average, right? Question 22, for a client with Graves' disease. All right, for a client with Graves' disease, which nursing intervention promotes comfort? Now, first of all, you got to think about what Graves' disease is, right? Got to understand the pathophysiology of what that disease process is. Now, which one promotes comfort? Do I want to restrict the intake of oral fluid? Do I want to place extra blankets on the client? Do I want to limit intake of high carb foods, or do I want to maintain room temperature in the low normal range? All right. Everybody's telling me D. Some of y'all from yesterday were telling me D. I wonder why. Oh, light work. Yep. I'm talking about you. City girl. Tweedledee is telling me A. Okay. All right. Yeah, Katie. Yep. Hey, you ain't slick now. Y'all ain't slick. All right. Well, let's see what the answer is. Let us see what the answer is in 3, 2, and the answer is D, is to maintain room temperature in the low normal range. Now, Graves' disease causes signs and symptoms of hypermetabolism such as heat intolerance, diaphoresis, excess thirst and appetite, and weight loss. To reduce heat intolerance and diaphoresis, the nurse should keep the room temperature in the low to normal range. As part of basic care and comfort. Basic care and comfort is 6 to 12% on the NCLEX. Smaller section, but still very, very much important, right? Graves' disease. The other name for Graves' disease is hyperthyroidism. And the signs and symptoms of hyperthyroidism are up. Hey, I thought about Missy Elliott. What? You put the game down, flip it, and reverse it? Is that what you're talking about? Never mind. Oh my goodness. Anyways, hey, make sure you guys understand. All right. Hey, hyper and hypothyroidism fall under endocrine. They fall under endocrine. Okay. Here we go. Question number 23. Patrick is treated in the emergency department for a collis fracture sustained during a fall. What is a collis fracture? So now, what type of question do you think this is? All right. Is it a fracture of the distal radius, of the olecranon, humerus, or carpal scaphoid? DD is telling me B. All right, cool. All right, let's see. Purpose driven's telling me A. Okay. Rose is telling me A. Katie's telling me A. Don K is telling me A. All right. Crystal's telling me A. Shout out to all 77 of y'all out here rocking. We're doing NCLEX questions. I got them off of nurseslabs.com. They are free sets of questions. By the way, for anybody to come over here and tell you that these aren't NCLEX questions, I want you to ask them if they went to the National Council and did like all tens of thousands of the questions that they have in a question bank. That's what I want you to ask them. All right. So the whole point, to get you into a routine. That is the point. All right, here we go. And the answer is A, fracture of the distal radius. All right, so a collis fracture is a fracture of the distal radius, such as from a fall on an outstretched hand. It is common, most common, in women. Physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. All right. 11 to 17%. Now, with these questions on nurseslabs.com, do I like them? They're okay. Are they the best? Absolutely not. When it comes to me giving you guys suggestions on where to buy your question bank from, hey, I like Kaplan, I like Archer, I tolerate UWorld. Those are my suggestions of where I like to tell. Now, if you want a review that's very, a robust review where it has like 80 plus videos where I break down NCLEX style questions and I give you 2 reviews, you can check out mine and it's linked in my bio. All right, here we go. Question number 24. Cleo, calling me now, child. I'm sorry. Is diagnosed with osteoporosis. Which electrolytes are involved in the development of this disorder? Is it calcium, sodium, calcium, phosphorus and potassium, or potassium and sodium? Where's Naz at? Naz, you better answer this question if you're still in here. All right. Shout out to all 80 of y'all. We are rocking, doing NCLEX questions. Hey, I need 25,000 likes. I need 25,000 likes. All right, everybody's telling me B. Here we go. Here's our answer. And the answer indeed is B. It is B. All right, in osteoporosis, bones lose calcium and phosphate salts, becoming porous, brittle, and abnormally vulnerable to fractures. All right, physiological adaptation. Why? Because it asked about osteoporosis. That is a disease process, right? And how does it affect the body? Oh, okay, well, it can make you prone to fractures. There it is, right? Due to the stability of the actual bone in the bones with the minerals, right? So physiological adaptation, 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. All right, here we go. Question number 25. Question number 25. 5. Johnny, a firefighter, was involved in extinguishing a house fire and is being treated for smoke inhalation. He developed severe hypoxia. He developed severe hypoxia. He developed severe hypoxia 48 hours after the incident, requiring intubation and mechanical ventilation. Requiring intubation and mechanical ventilation. All right. He most likely has developed which of the following conditions? Is it ARDS, atelectasis, bronchitis, or pneumonia? What do we think it is? I had to say that. I feel like if I said those things 3 times, I pulled off my Dr. Umar, so y'all know how important it was. All right. Rose is telling me D. Okay. Crystal's telling me A. All right. Light work. I don't know why I keep saying that. I'm sorry. Light work telling me A. All right. Shout out to you. 25K. What are you talking about? Okay, there it is. I see it. All right, cool. All right. Let's see what the answer is. And the answer is A. Indeed. Severe hypoxia after smoke inhalation is typically related. Why? Because of the lack of O2 and CO2 exchange due to carbon monoxide, right? That's why. That's exactly why. Physiological adaptation. Thanks for sharing, guys. I love y'all for sharing. I appreciate y'all. Physiological adaptation, which is 11 to 17% on the NCLEX, making it the 3rd largest section on the NCLEX exam, okay? So, hey, I'll beat a dead horse. I want for y'all to understand this. And I don't need TikTok to really feel like I'm beating a dead horse. They're going to blame me. They're like, you animal cruelty. Like, first of all, I'm going to need for you to chill. Ladies and gentlemen, once again, if you are new here and you have not gotten this ebook, that's a free ebook of mine, go over there and get it. It's going to go away. And y'all know when I tell y'all it's going to go away, it's going to be sooner than later. This has been up for a while. So I want everybody to take full advantage of that. All right. I'm going to be putting something else up, but it's not going to be anywhere near as robust as this one. All right. So if you don't have it, I surely suggest you go get it and go 42 pages. You get everything but the kitchen sink and that dude and his fanny pack. You know what I'm saying? So make sure you guys go over there and get that. All right. Here we go. Question number 26, a 67-year-old client develops acute shortness of breath and progressive hypoxia, right? Requiring right femur. The hypoxia was probably caused by which of the following conditions? Is it asthma, atelectasis, bronchitis, or a fat embolism? It says, give me a couple days. It says, give you a couple days. Look, you got until this live is over. It says going to review it after the live ends. Love it. What do we think it is? All right. Somebody who had a femur fracture, right? Hey, listen, bones aren't solid, y'all. Bones have all different types of stuff in them, right? They got blood, you know what I'm saying? They got all kinds of stuff that in them, right? So what happens if I have a femur fracture and then, all that other stuff decides to get into my blood vessels? What are we thinking, right? And a fat embolism can turn into what? What can that turn into, right? So, and the answer is D. You are correct. It is a fat embolism, all right? Long bone fractures are correlated with fat emboli, which cause shortness of breath and hypoxia. Pulmonary embolism. Hey, listen to me. If you have never seen a pulmonary embolism in real life, let me tell you. It says, I only have my phone to download it. I have an Android. First of all, don't badmouth Android like that. All right. I'm recording right now on this Android. All right. I'm gonna need for you not to disrespect Android. All right. You know what I'm saying? Android is love out here. You know what I'm saying? Physiological adaptation, 11 to 17% on the NCLEX. All right. 11 to 17% on the NCLEX, making it the 3rd largest section. No, I know you're not badmouthing, but hey, you Apple users, y'all out of pocket. You know what I'm saying? Y'all out of pocket, and I won't stand for it. Just saying. All right. Let me tell you something right now. What's her name? What's her name? If Amos, if you're in here and you use Apple, hey, I'm slandering you and then I'm banning you. So I'm just letting you know. Question 27. A client with shortness of breath has decreased to absent breath sounds on the right side from the apex to the base. Which of the following conditions would best explain this? Is it acute? It says, not too much. Okay. Not too much on us. I got you. All right. Is it acute asthma, acute bronchitis, pneumonia, or spontaneous pneumothorax? So you got to think about it. What are the key signs and symptoms? Some people are going to sit here and be like, man, these questions are really easy. But let's talk about the signs and symptoms of these disease processes. What would you see? What would you see for somebody who has absent breath sounds, right? Because think about it. That right there is a cue. That is recognizing a cue, which is a category on the NCLEX, right? They let you know, do you recognize the cues that are given to you in the question? Do you know what the vital signs mean? Do you know what the signs mean? Do you know what the symptoms mean? Do you understand by recognizing these cues? Can you come up with a hypothesis of what the answer of the disease process is? That's what it does. You say, a lot of people will be like, man, these are easy, but you think about it real one dimensionally, right? You got to think about it. There's a purpose on why it's written the way that it is. All right. The answer is D, spontaneous pneumothorax. A spontaneous pneumothorax occurs when the client's lung collapses, right? Causing an acute decrease in the amount of functional lung used in oxygenation, right? The sudden collapse was the cause of his chest pain and shortness of breath. That's physiological adaptation. 11 to 17% on the NCLEX exam. All right. Third largest section on the NCLEX exam. Remember, you have all this positive pressure coming from outside, meaning out here in the earth, pushing up against something that requires negative space, right? Because we've got to think the lungs are supposed to fill that entire space. It's not supposed to be the air coming from outside in the world filling that space. All right. Think about that. Think about that. All right. So shout out to y'all. Here we go. Question number 28. A 62-year-old client was in a motor vehicle accident as an unrestrained driver. Hey, wear your seatbelt, ladies and gentlemen. He's now in the emergency department complaining of difficulty of breathing and chest pain. You better be glad that's all he's complaining about. On auscultation, on his lung field, no breath sounds are present in the upper lobe. This client may have which of the conditions? The bronchitis, pneumonia, pneumothorax, or tuberculosis? Obviously. Let me not say obviously, but think about that. Right? And a lot of times when you guys are studying, this is why it's so important that you read your rationales, is that you could get a question like this. And then 5 or 6 questions down the line, you could get the same question, but it written differently. That's why it's important that you read your rationales, because you never know what's going to be given to you later on down the line. All right. It's all a part of the test taking strategy. OK, that's why it's important. There's a reason why I say RTFQ, RTFA, and RTFR. OK. And indeed, it is a pneumothorax. It is defined as the presence of air or gas in the pleural cavity, which can impair oxygenation and or ventilation. Physiological adaptation, right? Pneumothorax is a disease. It is a disease. And how does it process, right? So think about it like that. It is a condition or a disease. And how does it affect the body? Well, there's air that's going into the pleural space where it's not supposed to be, inhibiting you or inhibiting the patient from proper oxygenation, all right? Physiological adaptation. 11 to 17% on the NCLEX, third largest section. Amos, what are you about to say to me? What are you about to say? You about to talk out of your, you about to talk, Look, I'm already mad. All right, here we go. Question 29. If a client requires a pneumonectomy, what fills the area of the thoracic cavity? Is it the space remains filled with air only? The surgeon filled the space with gel. Serous fluid fills the space and consolidate the region, or tissue from the other organs grow over to the other side. What do we think? Look, Amos, I'm not even dealing with you. All right. We ain't dealing with you today. Shout out to all 71 of y'all out here rocking. We're doing NCLEX questions. Shout out to y'all for getting me to 30,000 likes. I appreciate you. Hey, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, if you're in here lurking, hey, show me some love. All right. Show me some love. Hell, even just type in here, Kevin, I'm lurking, and you can go away. That way I can just be like, oh, okay, cool. Okay, cool. My man Kobe's in the building. Kobe, I see you, bro. I appreciate you. Hey, if anybody ever wants to get into the hospitality industry, go follow my man Pre-Shift Service. He'll get you right. His videos are actually really good. So shout out to you, Kobe. Calgary, I'm about to say Calgary, North Carolina. Calgary, Canada. Shout out to you. Shout out to you, Miss Lady. Or Miss Sir, whomever you may be. Hey, you from Jersey? Hey, shout out to Jersey. Woo woo. Miami, Florida. Killing it, Kevin. Hey, I appreciate you, brother. Jamaica, Miss Lady. It says, hey, Kevin, graduating from my accelerated BSN on Sunday from NY. Shout out to you, Caitlin. Working at Amazon. I know that's right. No, wait, I know that's not right. We don't like Amazon like that. Do we, Alice? Do we? Shout out to St. Louis. Shout out to Orlando. Roxborough, North Carolina. Okay. It says ill for New Jersey. I'm just playing. I'm just joking. I'm just kidding. It says Illinois repeat test taker. Hey, I love it. I love it, Chelsea. You want to know why? It's because you're delayed. You're never denied. And that's okay. All right. Everybody out here has a story to tell. All right. And never let anybody try to stifle you from telling your story. It's a part of your story. All right. No one's going to write it but you. Promise you. Trust and believe me. All right. The answer is C. Serous fluid fills the space and eventually consolidates, preventing excessive mediastinal shift of the heart and remaining lung. That's physiological adaptation, which is 11 to 17% on the NCLEX exam, making it the third largest section. I take the NCLEX for the RN in 5 days from Kansas. Hey, you got this. Hey, the day before your exam, don't do anything. Don't study nothing. Hey, if you don't know it by then, you don't know it at all. I truly believe that. You better what? I better say that. I did say that. What are we talking about? I did say that. All right. No, I got you. Let's work. Or I'm sorry. Let's work with light work. Here we go. Question 30. Hemoptysis may be present in clients with a pulmonary embolism because of which of the following reasons? Is it alveolar damage in the infarcted area? I'm immature. Involvement of major blood vessels in the occluded area, loss of lung, Parencia, whatever. Loss of lung tissue. Y'all know what I'm talking about. I had somebody come in here flat out tell me, how you are a nurse and you don't know how to pronounce these words. I was just like, look, bro. And that's all I said. That's how you ignore people. Hey, I'm saying, you're not going to know everything. You ain't going to know how to pronounce them. You just got to get over it. So shout out to everybody that's out here rocking. All right. Hey, a little bit about me. I have been an RN for almost 4 years, BSN. I live in Texas. Specifically, I live in San Antonio. So shout out to all my San Antonians out here. You know what I'm saying? Shout out to y'all. I was in the Navy for 16 years. I just got out this past January. I did 2 deployments, if you really care about that. And I failed my NCLEX 3 times, passed on the 4th. I decided that then and there, I never wanted anybody else to feel how I felt. So I started coaching. Literally, I started coaching. I took my teaching certification that I had while I was in the Navy and I started coaching everybody for NCLEX. So starting in 2020, that's when it happened. So I've been coaching people for 4 years. All right. And that's why I'm here. I'm here coaching y'all because that's what I like doing. All right. But the answer is A. It is alveolar damage in the infarcted area. All right. The infarcted area produces alveolar damage that can lead to the production of bloody sputum, sometimes in massive amounts. All right. That is part of physiological adaptation. Sassy Cassie. Hey, I'm not even going to lie. That's an awesome ass name. I'm not even going to lie to you. Because that caught me off guard. Physiological adaptation, 11 to 17% on the NCLEX at, it's the third largest section. I was going to pick A. Well, guess what? You didn't. Did you not go with your gut answer, Bria? Bria, we've talked about this. We've talked about this numerous times, all right? Hey, by the way, RTFQ, RTFR, RTFA, right? Read the fucking question, read the fucking answers, and read your fucking rationales when you guys are studying, all right? That's nothing but love, I promise you. All right, here we go, ladies and gentlemen. All right. Hey, when I just told you everybody has a story, I have a story, right? I have a story. And my story is to tell you how I conquered it, right? I tell you what happened with me while I was studying for it, why I wasn't able to accomplish that goal. And on top of that, I tell you what I did in order for me to accomplish that goal. This book, legitimately, this book is dedicated to nursing students and nursing graduates, specifically to y'all. I wrote a whole dedication page specifically for y'all. Why? Because I used to be there. Y'all don't get talked about enough. We didn't get talked about enough, right? Everybody wants you to come here and come work in somebody's hospital, but nobody understands the struggle that somebody really goes through. So, hey, I do. And I wrote about mine. It's my story and I want y'all to read it. All right. Listen. If I've given you anything for you to do anything for yourself, hey, go check that out. It's a good read. 9 chapters, 124 pages. It's coming out June 5th. Go check it out. All right. Once again, go over there and get you some free questions that you can download. You know what I'm saying? Or questions you can download. It's a free PDF that you can download. Make sure you guys go over there and get that. All right. Hey, and of course, ladies and gentlemen, I was on a podcast called Nursing Uncensored, right? It actually just got released this past last Monday. All right, it got released last Monday. I want you guys to go over there and check that out. I talk about toxicity in critical care, talk about NCLEX prep because that's what I do for y'all, and building a community because that's what I do with y'all, right? We build a community together, all right? It's a good, it's about an hour, almost an hour, right? It's a good time with Nurse Adrian. If you guys don't follow that, go over there and check that out. It's a good read. I'm sorry. It's a good listen, all right? You can find it on all those podcast platforms. But of course, ladies and gentlemen, I appreciate you guys for coming in on this Wednesday, for hanging out and participating. Thanks for the gifts, the likes, the love. Although the gifts are not required, they are surely very much appreciated. All right. I didn't have to ban nobody. Amos was about to get that ass banned, but I decided to, to let off, you know what I'm saying? Because, it's Wednesday, it's hump day. So I decided to give her some grace. I didn't have to ban nobody. And usually when I ban you, you deserve it. And I'm petty. So I'm just letting y'all know that. Once again, I got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there. Check them out for yourself. All right. You don't need me to study. However, I do love you guys being here. I do love you guys being here for me to help you get your study on. Trust and believe that. All right. Nursing Uncensored podcast. Go check that out. 7-day NCLEX course. That's my course. Right now it's $97. Go over there and get it. You get it. You get it forever. You get it forever. The link is in my bio. All right. And if you're one of those people that have been unsuccessful at NCLEX, that need more help, one-on-ones, don't know where to start, don't understand how to break down questions, have a problem with content, I do coaching. I also have an ebook over there. You guys can go over there and check out. All that stuff is linked on my main page in my bio. So make sure you guys go over there and check it out. All right. And of course, I'm going to sit here and I'm going to answer some questions right now. What's up, everybody? How we doing? How we doing? How we doing? How we doing? What's up? What's up? Sorry, like my eyes are like, once again, it's a change of the seasons, right? So eyes is out here watering like crazy. So shout out to every one of y'all that are out here rocking. Hey, if you guys are just now joining, my name is Kevin. I've been a nurse for, like I said, 4 years. I worked ICU, OR, and PACU, right? Hey, ICU, OR, and PACU. I'm also in a master's program. I don't know if I told you guys that. I'm in a master's program to get my master's in education. What's up, Grandma Jill? How are you? It says, thank you so much, Kevin. You are very welcome. You are very welcome. Hey, so like I said, I want to know about you. I want to know who you are, where you're from, where you're at in your nursing journey. I'm going to hang out here for about another, I don't know. I'll hang out here for as long as I need to. So, light work. I appreciate you. Thank you. You're welcome, Bria. You're welcome. You're welcome. Thank you so much. Ali, you are welcome. Do you have any specific or any tips or recommendations? Any study aids specifically for pathophysiology? There's one guy on YouTube. I think it's Ninja Nerd. Ninja Nerd has some pretty good stuff. Also inside of my program, I go over the disease processes. So for example, I have 5 videos in my endocrinology or endocrine, where I talk about DKA, I talk about HHS or HHNK, I talk about hyper and hypothyroidism. So I have a whole cardiac section where I talk about shock, MI, heart failure, heart blocks, VTAC, VFib, AFib, A flutter, like all of those. So I know Ninja Nerd, and there's a couple of other ones that are really good out there. I think Osmosis on YouTube, but then also I have a course that you can take or you can have. That's part of that. And I update it all the time, and I have stuff that's going in there as well. So congratulations on the program. Thank you. It says retired biomed and pharmaceutical side. Shout out to you. Hey, listen, biomed and the pharmaceutical side, especially if you're working, like the nursing aspect is huge. It's huge, huge, huge. I had somebody come and give us an in-service on, oh man, it was something that was for the cath lab, but essentially it's like a collagen plug that they used when they were doing like endarterectomies and stuff like that. So essentially the collagen plug is used so that way we don't have to put so much pressure down on the femoral artery. So essentially it does the clotting factor for itself. And I was just like, whoa, that's pretty cool. So a Vascade, that's what it's called. It's called a Vascade. So if you know what I'm talking about, let me know. Yeah. It says, I just started LPN. I'm so confused with fundamentals. Fundamentals is all about memorization. I kid you not. Like you got the thing that Oliver, the thing about it is that you're now trying to understand the nursing process. right? And all the nursing process is basically off of memorization. You need to know what are the safe things that you need to do. And fundamentals is all about understanding the skills too. It's basic, like the basic care and comfort. That's what you learn in fundamentals as well. I'm about to go into my third semester of nursing. Shout out to you, Allie. Shout out to you. All right. So I don't know what your third semester consists of, but I know like my third semester of nursing school consisted of, I think, peds and OB, I think. Yeah, peds and OB. So what other questions do you guys have? Happy Wednesday. Anybody else pass NCLEX? Anybody else graduate? I'll give you guys a shout out. All the love and all the support. Got 40 people up in here. All right. If you guys are just now joining, we did NCLEX questions, right? We do these questions every Monday, Wednesday, and Friday at 5:30. Now, I know a lot of y'all are going to be like, Kevin, we did these questions already. I know we did these questions. We did them on Monday. Even though we did these questions on Monday, some of y'all got them wrong. So I'm saying some of y'all got them wrong, even though you saw them on Monday. Just saying. But I had a lot of people message me and ask me if they could go through the questions again. So that's all right, Katie. I wasn't talking specifically about you, but I'm just saying, even it's proven, and this is what I've learned as an instructor. I used to be able to teach to the test, right? I knew exactly what was going to be on the test. I would literally create a review, and we would make it fun and everything. And I would literally ask them questions. Not directly out of the test, but I would ask them questions that would be very similar to what would be on the test. And believe it or not, out of 25 people that I would be teaching, believe it or not, 5 to 6 people would still fail. And not only would they still fail, I would have a whole bunch of people that would be barely passing. They would barely pass that exam after I literally went through the whole test, right? So this is how you have to understand what you're doing wrong and what you need to do in order for you to improve that. I think these are great. At teaching absolutely. And that's why I like to do them. And that's why I like to teach. I never thought I would be one of those people that like to teach. And then I came back from Afghanistan and I was like, I want to teach. Like, I want to leave my mark on the Navy. I want to be able to teach the youth and, do my part. And I got to do that. So I left my mark on the Navy. So shout out to me. I'm actually going to figure out how to do sound effects on here, because everybody that graduates or everybody that does NCLEX and they pass, I want to be able to do a sound effect to where it's like, woo, round of applause type deal. But shout out to all 30 of y'all joining. We did NCLEX questions. We do them every Monday, Wednesday, Friday at 5:30 Central Standard Time. Right now, we're just doing an Ask Me Anything. I'm going to hang out for a couple of minutes. Katie seems to be the only one taking advantage of this, which is fine. If anybody has any other questions, you guys ask me what question. Do you have questions about, were you one of those people who just started your nursing journey and you're just like, man, I don't know what to do. I don't know where to start. I don't know where to begin. Are you studying for your HESI or your ATI? You want to know how to make your nursing application competitive? Are you just now in nursing school? Did you graduate already? You take NCLEX already? Did you fail? Are you a new nurse, new grad nurse, or a new hire, new grad type working at a hospital going through imposter syndrome? Are you one of those? So you guys can ask me those questions. Allie, did you ask me a question? I see your arrows going up, so I don't know if you asked me a question or not. I'm terrified to fail. That's okay. Don't be terrified to fail. So, Katie, let me ask you this question. What's the worst thing that could happen to you if you were unsuccessful at NCLEX? What's the worst thing that could happen to you? Think about it. As someone coming from a different country, what can I do to make my resume more desirable? So, brown sugar. I don't know exactly where'd you say you live at again? It wasn't in New Jersey, right? Something that can make your resume something that'll make your resume look really, really well is volunteering, right? Especially if you volunteer, you're from the Bahamas. Okay. So volunteering at the hospital, like, let's just say, for example, remind me again, brown sugar, are you trying to get into school? Are you about to take NCLEX? Like, let me know your situation, and then I'll answer that. I want to make sure I give you all that stuff. I'm interested in critical care. Okay. So Katie, the worst thing that can happen to you is push your date back. That's the worst that can happen to you. I'm talking about overall. We're not talking about the test. I'm talking about you in life. What is the worst thing that could happen to you if you failed an exam? Any exam, not just NCLEX, but any exam. What's the worst thing that could happen to you? I'm finishing nursing school in December. Okay. Um, essentially, as a new grad, they put it this way: they need nurses everywhere. They need nurses everywhere, and I'm not saying that just to toot nobody's horn, but they need nurses everywhere, right? So my biggest suggestion to you, even though I'm not super fond of them, is when you graduate and you get your license, or even before that, is that you should join a residency program. Now, here's what you need to do with regards to the residency program, as well as because you still have to get hired. Is you need to read the contract, right? Because a lot of these places like HCA, which is super heavy about it, at one point they were trying to lock you into a 3, 4 year, 5 year contract and give you $100,000, right? But those have since went away. So I would really look at the fine print of the contract. Number one. Number two, in order to make yourself, because they're going to ask you for an interview. Number one, right? You'll have an interview with the nurse manager or the director or whoever. You need to know what the hospital's mission statement is. That's a big one. Know what the hospital's mission statement is, and then tailor it into your verbiage of your actual interview. Right? Understand that specific unit. If you live in the Bahamas and you want to go work in, I don't know, let's say North Carolina, and you want to go work at a specific hospital, or that's where you got hired at, or look at the units. Look at the units. What do they have? Who can you talk to about those units in order to get a little bit more insight? Are you a team player? These are the things to make your resume look good, or for your interview process, right? But for your resume, you're going to be a brand new nurse. They take brand new nurses everywhere. You're not going to have a problem. Trust and believe me. Let me see. Just disappointed in myself, and then increased fear of not being able to pass. So, Katie, let me ask you this question. Have you ever had anything personal to you in your life that you didn't do well at? You looked at it, figured it out, and then you felt very accomplished? Don K says, I repeating my med search 2 for the second time, and I have high levels of anxiety because I want to pass. Okay, so you're repeating it because you didn't do well the first time. So why didn't you do well the first time? And when you answer, you don't have to answer right here, but when you look at it and you didn't do well, that is where you improve upon. Just passed my med search final. Shout out to you, Sophie. Shout out to you. I wish I knew how to do the sound effects. I would give you like a woohoo. But congratulations to you, Sophie. On to the next one. All right, I failed my first semester of nursing school, but I was so proud of myself when I graduated Saturday. Good. So you failed your first semester. And you didn't, so you had to repeat it again, right? So you mean to tell me due to that failure, you learned why you didn't do well that first semester to now tell me that you're a nursing graduate? Is that what you're telling me? Same concept, Katie. Same concept. I'm looking into going to nursing. What was it that kept you going to become a nurse? It was my wants. It was my want, my drive for more responsibility, and my want and drive to take care of my fellow brothers and sisters in arms. That's what it was. Because I was in the Navy when I decided I wanted to be a nurse, and I realized I wanted to take care of my own. And it was every soldier, airman, sailor, now guardian that I could ever be, that I ever came across, because that was my atmosphere, that was my love, those were my people, and I still do that. I still do that to this day. Is it Nini? Hello, what's up? So, Katie, to answer your question, you improved upon what happened to you the first time. So who's to say that can't be rinsed and repeated? That's why I said the worst thing that can happen to you is probably you not be here. I mean, think about it, Katie. I'll give everybody perspective in here. You could be somewhere on the Gaza Strip. You know what I'm saying? You could be somewhere. You could be in somebody's Ukraine. I'm going to give you guys perspective. Mostly it's because I'm a veteran and I have a different perspective than a lot of people don't have, right? You could be somewhere else, right? Not worrying about if you fail an exam, but just worrying about, are you going to see tomorrow? And so I say that in a way I want you to really think like it's okay for you to fail. It's okay for you to not do well. But what's not okay is for you to quit. All right. I'm just saying. And what obstacles did you face? So I had a lot of obstacles. When I said I wanted to become a nurse, I ended up getting deployed for a year, so that postponed it. I was still active duty. I moved 1, 2, like 3 or 4 times in between there. It took me 8 years to become a nurse. And then when I finally did do it, it was 8 years later, 3 failures, and then, finally becoming successful because I just didn't know. There was a lot of things I just didn't know. Nursing school was all a blur to me at one point. And then when I asked for help for, where to start for NCLEX, it was crickets, especially from people at my school. So, it was just, it was a headache. So then I actually found a mentor, and that mentor guided me. Literally was just like, you need to look at this. You need to look at this. What's the area that you have the hardest thing in? All right, you have to totally restructure your life. And I restructured my life temporarily for the next 2 to 3 months. And then I ended up getting a license. So there was a lot of obstacles that I faced. Do you have any advice for negotiating contracts details as a new grad? So here's the thing. As a new grad, you hold no leverage. Listen, I've seen so many new grads and like they try to go in there and they'll be like, look, I want $50 an hour, but these places are going to look at you and they're just like, what? Like, why would we give you $50 an hour when you have nothing to necessarily bring to the team because you haven't done anything as a nurse? And I'm telling you that even with my military background and my 2 deployments and me doing stuff, critical care wise, but not as a nurse, they don't care. They don't care about that. Right. It's like, what do you bring to us? Like as a nurse, and as a brand new nurse, you have nothing to bring. So your negotiating details in regards for a contract are going to be pretty much non-existent, at least for me, at least from my experience. That's what I've had. Katie says, amen. All about perspective. Thank you. You are welcome. No plan B. Listen, there is no such. Hey, listen, when you guys are striving forward to go to stuff, hey, however you got there, burn them. Those boats that you got on that island with, burn the boats. There's no going back. It's either you're going to fight through it and you're going to get through it. Katie, I'm going to say this one to you since we're talking about failing. There is no turning back. For everybody that's just like, oh, I will just fail the NCLEX and I'll go work wherever else. No, there's none of that. There is no going back. It's only going forward. All right. That's the only way you're going to do it. No plan B. It said, that's so inspiring. Thank you for your input. You're welcome. I didn't get this far to only get this. Exactly. You didn't get this far for you to just be like, all right, it's cool. Let me turn back. This isn't Forrest Gump where he's just like, I'm a little tired. I think I'm gonna go home. Nope. There's no little tired. We're keeping going. We're gonna get out there. We're gonna get out there where Voyager 1 and 2 is at. Somewhere out there. It took them 50 years to get out there, but you know what I'm saying? We're still going that direction. How do you choose a good mentor? You want to find a good mentor for somebody. Number one, somebody that you vibe with. I know a lot of people say, oh, I don't like the vibe and blah, 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 blah. Listen, shut the fuck up. Okay. Find somebody that you vibe with. Okay. Find somebody, but you have to find somebody who's going to, number one, who's going to be able to give you constructive criticism, who's going to be able to guide you, right? But it's also relatable, right? That's what you need. You need to find somebody, and you also want to find that one person who is, and you can have multiple mentors. I have tons of mentors, right? You want to find that person, like, let's just say if one of your goals is to become a nurse practitioner, right? Find you a nurse practitioner and go ask them questions like, hey, I got a bunch of questions about this, that, and the third. Can you answer them? Right? Or if you're in critical care, find if you can get with a preceptor that can also be your mentor that you like, that's cool too. That's cool too. You can do that. Right. But you want to find somebody that you guys, that somebody who is above you. And there's nothing wrong with somebody being equal. Right. But somebody that's above you where you're striving to continuously be at because they're already there. Those are the type of people that you want as a mentor. All right. There's nothing wrong with being around people that are equal to you. But the whole point about not just nursing, but in life, it doesn't matter what it is, you want to progress upwards, right? So find that person that's up there, right? I would never ask anybody who is a CNA how to become a nurse practitioner. That doesn't make any sense, right? I would never ask an LPN how to become a nurse practitioner because they're not a nurse practitioner. Or I would never ask an LPN to be my mentor to become a nurse practitioner. You see what I'm saying? That doesn't make any sense. This is no shade on anybody like that, but it's the truth, right? It's the truth. Like if somebody came over here and you're like, Kevin, how do I become a nurse practitioner? I'm like, I'm not a nurse practitioner. And I was like, but I do know in order for you to get to nurse practitioner school, depending on which one, you need to have a specific amount of time in these areas. But the best person to ask would be, I would tell you to find a mentor in your area locally that somebody will mentor you. That would be my answer. Hopefully I answer your question. So what other questions do you guys have? Hey, y'all held me hostage. I was going to get off in like 5 minutes ago, but y'all asked me questions. So what other questions do you guys have on this Wednesday? What other questions do you guys got? Hey, if you guys are just now joining, we do NCLEX questions every Monday, Wednesday, Friday at 5:30. My name's Kevin. I'm a registered nurse. I've been a nurse for almost 4 years. And I'm an award-winning author. Bro, y'all hear that? I am an award-winning author. Like, that shit's crazy. It's crazy. It is crazy. So, Brown Sugar, hopefully that answered your question. All right. What other question do you guys have before I get off here? But one thing I will say is, number one, always take care of yourself. You have to be able to take care of yourself mentally, spiritually, physically, because if you can't do that, you can't take care of anybody else. It did. You're welcome. So that would be my thing. Next thing I would recommend is make sure you guys go follow me on Instagram and on, of course, here on TikTok, right? And make sure you guys go follow me on YouTube. Eventually, all these videos that I do here on TikTok will go on YouTube. All right. And I actually have a lot of videos that are inside. Katie, you're welcome. A lot of videos that are inside of my 7-day NCLEX course. Right now, there are 84. There's 84 videos in there. 84 videos that are in there. So like I said, once you guys get it, it's yours forever. It's yours forever. And you get all the updates. And I'm updating it all the time. All right. So like I said, I definitely want you guys to go over there and check that out. Make sure you guys go check out my link tree. And even if you don't want to check out the link tree, send it to somebody else who might need it. All right. Even if you don't need it, send it to somebody else who might. All right. That's the whole point. Sharing is caring. All right. So, but yeah, I appreciate everybody stopping by. I appreciate everybody coming to the live and getting there, learn on and participating. But of course, I will see everybody on Friday. I'm going to feel burnt out from nursing school. Is it a good idea to take a break? What do you mean? Ma'am, you don't take no break until you get a license. How about that? There are no breaks. You don't listen. I would never tell you to join. I would never tell you to prepare your whole life or to prepare months for a marathon. You join the marathon, you run, you see the finish line, and then you just stop and you start walking. I would never tell you to do that. You got a mission. You are on a mission right now. And that mission is to get that license. You can go on a vacation and take a break when you get a license. Because guess what? Now that part of the marathon and that journey is over. You have reached the destination. Now you can take a break and you can walk to the next one. I'm just saying. But then again, you do you. Remember, I have my license. I went through my journey. I got to the destination. So for you, depends on how long you want to get there, or how long you want you know what I'm talking about. How long do you want for it to take for you to get there? All right. Like I said, I'll catch everybody here on Friday. Bye.